thank Prentice for being here, or for having us here, and to lay out, or begin to lay out what I think is ought to be the women's health agenda for the United States Congress, and where we go. Not just providing direct service and care, which is our #1 priority, but to lay out an accelerating improvement of care, and especially to make sure that young women, 20 years from now, face far better prognoses, a higher quality of life in their futures, if we are providing care with increased taxpayer support, as the Congress has mandated. Are we really improving care if physicians are not available? That while you may have a promise of additional government assistance, can that be actually delivered when physicians are not present? We know now that 1 in 7 obstetricians do not deliver babies. That 49% of American counties do not have a resident OBGYN. That 75% of neurosurgeons no longer operate on children. That 50% of neurosurgeons and 25% of ER doctors are sued annually. And that 48% of medical students will now avoid specialties in high litigation areas. My concern here is when you look at the overall rates, and I'll point you to the chart on my far left here. Look at the rates across Illinois to keep a doctor in practice, as opposed to the other states there. Or the overall rate, as you can see here, in OBGYN services. Now, right now, we have the effect of a state reform law, which was in place for 4 years. And so some of the problems that were so evident in our state 7 years ago have been ameliorated some. But the Supreme Court has struck down this reform. I'm concerned because when we look at the future, it does appear that we will have a substantial increase in lawsuits, in medical malpractice law firms. It looks like we've had now a doubling of medical malpractice law firms active in the state of Illinois, and an increase in costs. When we look at the specialties, obviously OBGYN services and neurosurgery being the hardest hit. And you can see that the costs are higher across the board as compared to other states. You know that this has an economic impact as well. Illinois ranks 48th of the 50 states in job creation. Much of this is because new employers will look elsewhere if the quality and availability of medical services falls below that of other states. Now, here in Chicagoland, where most Illinois citizens live, that is less of a problem because we have outstanding medical centers like Prentice available. But south of I-80, this becomes an issue in the decision to locate new economic activity. I am worried that we now lack this reform for the state of Illinois. Look at the record of Texas and their reform statute. Now, Texas was one of the lowest served states in the country before its reform statute. It had the lowest ratio of nearly all 50 states for physicians per capita in the state. It had no obstetrician services in 158 of its 254 counties before the reform measure was put in place. But afterwards, we have now seen it accelerating in its rank in medical services among states. That in Texas, nearly 600 OBGYNs have returned to that state. And we've seen a reduction in medical care costs, and especially insurance for women in that state. We have reform states surrounding the state of Illinois as well, and you can see the strong incentive that is put in place there. Remember that the United States already stands far in excess of the most litigious society on earth, and this is having a direct impact. I'm also concerned about additional advances because we want to make sure that health care is not only available to Americans, but we also want to make sure that our daughters have a rising circle of quality and outcomes 20 years from now. And so the question is there anything that we can do that we would begin to build bipartisan support for and try to escape a partisan divide? And one of the areas that I would like to explore is to create a Food and Drug Administration rocket docket for any therapy or cure which would significantly extend the life of a mother or child. To bring that with some acceptable level of risk quicker to market, and to make sure that that was accelerated. I am concerned that in a number of therapies that I've heard about, they are more rapidly available in Europe than the United States. And I want to make sure that the highest level of care is always available to Americans first. The rocket docket is a famous part of the court system of Alexandria, Virginia, where they have taken the axiom justice delayed is justice denied very much to heart. I think that we ought to apply this also to the FDA, and I think that applies particularly in the lives of children.